you can see how many people will be joining.
Yeah.
So we're live.
Hey, Gio, welcome.
Thank you. How are you?
Good. I just noticed you were on.
Yes, I'm here.
Gio is the queen of PPE.
All right, well, it looks like our attendees have kind of plateaued, and the number's climbing a little slower than it has for past meetings. So I want to just get this thing going. We have about 330 people, plus the panelists that we have here. So thank you everybody for coming this morning as Bill Mara and his team and Dr. Liberati will be talking about the health and safety measures that we are taking here in the Torrance Unified School District with regard to our school reopening. Again, just to remind everyone that we follow the guidance of the Department of Public Health here in LA County, at the state level, the California Department of Education, and there are guidelines that go along with that. In order to physically reopen, we need to be able to follow all of the measures that will be need to be in place, the protocols. LA County continues to be on the state watch list for COVID-19 cases, and any physical reopening could only come after 14 days of being off that state watch list. And so we're still quite a ways away from that, per a call this morning with Dr. Ferrer at the Department of Public Health. So I just want to, welcome everyone. Thank you for taking your morning and being part of this. I know many of you have been on many of the calls that we've had. I'd like to make sure that I recognize a number of people that have demonstrated great leadership and work through this crisis. First and foremost with our Board of Education that has really made a difference in taking a stand for the health and safety of our students and staff and community, but continuing to look for options of how we can bring students back in ways that are safe, and also provide opportunities for students to learn fully 100% online. And so as we look forward to the school reopening and students coming back on August 26th, we have a lot of people working, and for better or worse, this crisis has shined a light on the great number of people in a school district, particularly ours, that make things work. Everything from our teachers and those certificated folks that work with students, to our administrators, our classified staff, maintenance operations, nutrition services, purchasing. So, I mean, in a way, it's really been an opportunity for the world to see how many people it takes to run a school district and to do it well. And so, I can't walk down the street or be on a phone call or anything without someone talking about schools, whether they know what I do for a living or not. Every conversation comes back to what our school's doing. And so I believe here in Torrance, we have a great level of support, as evidenced by all of the phone calls or all the people that are logging into these webinars. So without taking any more time, Gil, I will turn it over to Gil Mara, who's our Chief Technology Officer, and he heads up our operations team, and he will begin today. Thank you.
Thank you, Dr. Stowe. I'm going to go ahead and share the slides that we'll be speaking to today. But before I do, I wanted to talk just a little bit of how this is going to go. We'll try and present about half an hour's worth of information, content. There are actually two subcommittees here of the task force that are represented today. So there's myself that runs operations, and I've got my team in M&O, facilities, purchasing, and nutrition services that are also on the panel. And then we have Dr. Mario Liberati and John Pearson, who represent the health and safety portion of the task committee. So they have a subcommittee that they're managing. And I'll be presenting on the facilities piece, the operations piece first, right? So how we're prepping facilities and getting ready, getting our campuses ready. And then Dr. Liberati and John Pearson will take over from there on how we're managing our exposure management and how we're dealing with the HR piece, human resources, are working with our faculty and staff, and then what the protocols will be for keeping our students safe. Okay, so that's how it'll go. And then at the end of our presentation, we'll open up for Q&A, which will run about an hour, and we'll have a hard stop at 11:30. Okay, so let me get my slides up. All right, can I get a thumbs up if you can see this, my folks? All right. Okay, so I'm just gonna jump right in. So as Dr. Stowe mentioned, we must follow the guidelines of the Department of Health, and those were released back on July 13th. So it's an 18-page document that has a lot of content on it. And on the slide, what I've done is just picked out a few bullets, right, from that document that we'll go into in a little more detail when it comes to those guidelines. So first and foremost, we have to establish an exposure, a team, a compliance team at our school site level and the district level. So that'll be composed of, administration, site staff, and of course, folks here at the district office. We'll need to have a exposure management plan in place, and Dr. Liberati will go into that a little more. Some things that you probably already know and have heard: requiring face coverings for employees, parents, students that are here on campus, or even being transported on our buses, the need for frequent cleaning and disinfecting, providing hand sanitizer for everyone, putting measures in place so that we're physically distant between ourselves as much as possible, again, to prevent the spread of the COVID-19. And then, of course, physically distant when we're eating and having meals on campus, trying to avoid sharing of equipment, sanitizing their use after use, sanitizing equipment after the use. The health guidelines say that we can't have any spectator events or team sports, and however, conditioning and skill building is allowed, and we know that some guidelines came out from the sports organizations around that. And then some things like no choral groups when it comes to the music program on our campuses. So just some quick highlights there that we're gonna, drill down into. So how are we prepping our facilities, right? So we're mapping our sites. I'm gonna jump to a slide real quick, and identifying. So here's an example of one of our schools. So Ian Kempton, our director of M&O, is working closely with our our principals and the site staff to identify where on our campuses we need the signage. Where have we identified the quarantine and the isolation areas that the Department of Health requires? What about pathways? They want us to make sure that we don't have bottlenecks of a bottleneck of students or people as they go between classes or go up the staircases. Have we identified hand sanitizing stations? And so we're procuring a lot of hand sanitizing stations because some of our classrooms don't have sinks, right? So they may not be able to wash their hands frequently. However, hand sanitizing is a good method for, again, keeping the germs off of our hands if you can't get to a sink. So this is just an idea, or actually this is more than an idea. This is happening now. Every site is being mapped out so that we can identify all the components that we need to identify based on what the guidelines are saying we should. We're prepping our classroom and workspace. I think you've seen pictures of those if you've joined some of our board meetings. I've had pictures of those, and I'll have a few more here. Installing touchless soap dispensers, improving ventilation and airflow in the classrooms. We're developing we're creating plexiglass barriers. So we're doing that in-house and looking at outdoor structures if needed. Some of our classrooms may not have the space available to create a quarantine or isolation area. So we're looking at tents or outdoor tents that may provide more space to do that with, or even if not for quarantine or isolation, possibly an area where we can have students outdoors safely for activities. We need to lock the drinking fountains. So that's been a recommendation from Department of Health that, that's another high touch point that we need to avoid. But in lieu of drinking fountains, we're contracting out bottle filling stations so that we do provide fresh water to our students. And we're closing off our playground equipment so that those are not used. Again, it's an area that would be of a high touch point area and would be difficult to clean routinely. Okay, yeah, I can cover that slide. I think some of you may have seen this before. We're in the process of getting through all of our classrooms and physically preparing them so that the students can sit safely in the class, right, 6 feet apart. And roughly that translates to about 14 to 16 people that we can have in a classroom, right? So that we can, when we can't come back to school, it's about 50% of the students that we can have on campus along with the teacher. And here you have an example of one of our workers here in the shop developing, basically prepping one of the plexiglass barriers that we'll have by the time next month, end of August, I believe we'll have about 2,000 plexiglass barriers available that we can use in our campuses in various areas. Okay, so I've had a lot of questions about facility cleaning and disinfecting, and I kind of want to go over this in a little bit of detail. There's a big difference between cleaning and disinfecting. So we will provide frequent cleaning throughout the day, right, using a multi-purpose surface cleaners, hitting all the touch points, all the common areas, and adjusting our custodial schedule, and then bringing in more hands on deck so that we can provide this cleaning throughout the day. Disinfecting, however, is a different process, right? That's an EPA regulated process. So when we say disinfectant, we have to use these chemicals that are biocides or germicides, and they have to be EPA approved. So we can only disinfect a campus once a day because DPH says you should not have students on campus while you're disinfecting, right? Because you're using biocides. It's pesticides. It's regulated by the Department of Pesticide Regulations. And per the Healthy Schools Act, you have to have trained personnel to perform this disinfecting procedure in the classrooms, in the bathrooms, in the offices, right? So custodial staff have to be trained. They're provided specific PPE and respiratory right, protections like an N95 mask. So I wanted to make that distinction between cleaning and disinfecting. So let's take a look at the transition between an AM and PM. So at the elementary, right, we're going to have about 45 minutes to 50 minutes between when students leave, exit the campus from AM, and then another group comes in the PM, right? So in that time period, we'll be cleaning, right, thoroughly cleaning all of the desks. We'll hit the chairs, all the doorknobs, which are being hit throughout the day anyway, with our multi-purpose cleaners, right? So that most of the germs are going to be removed. And this will even occur during the A-B model, right, where students are transitioning from period 1 to period 2 to period 3. With that, using alcohol wipes, right, where they can wipe down the desk. Students can be allowed to use alcohol wipes. However, students cannot use disinfectants, right? That's literally against the law, California law, again, because disinfectants are a pesticide. And our staff cannot use disinfectants unless they receive their DPR certificate, which some of them are getting. So I just wanted to make that really clear as to the difference between cleaning and disinfecting. And you may have questions a little later on after this. So here's an example of disinfecting that is occurring. We've received 40 of the electrostatic disinfecting guns, I'm calling them, or sprayers, that has the BIOS disinfectant in the backpack here, and one of our custodians is spraying an entire classroom down. Again, you don't want anyone in the vicinity, right, as they spray this, so you want students around, or teachers really. And just a quick snapshot. So again, from the Department of Pesticide Regulation, do I need training to use a disinfectant? Basically, yes, you do. And for our campuses and for what we'll be using here in Stockton, our warehouse, where we have disinfectants, here on the right, Lysol disinfecting, Clorox, the waxy products, 3M, BIOS, those are the products that are regulated and only to be used by our staff that are trained. The general purpose cleaners will be distributed to all of our schools, and those can be used by anyone, right, because they're not biocides. So the general purpose cleaners, baby wipes or alcohol wipes, and then of course you can have hand sanitizers. So those can be used by the general population on our campus. Okay? So a lot of procurement going on here and a lot of supplies that we've already picked up. All right, so that's my piece on operations and what we're doing to prep the facilities and getting the supplies in place. So I'm going to turn it over now to, is it going to be Dr. Liberati?
It's me. Thank you. I'll run through 4 slides, and then Mr. Pearson will run through 4 slides, taking us through slide 16. But thank you, Gil, and you'll see, and I've mentioned this in the task force as well, and parents, thanks for joining us. Quite a bit of overlap. You're going to hear some repeat. Again, we do that to emphasize what we're hearing from the different guidance that we've received, and through the HR Health and Safety Committee, of course. We've reviewed many different documents providing guidance, direction, and support from the CDC and the California Department of Health. And our primary contact is the Los Angeles County Department of Health. As a matter of fact, Dr. Stowe mentioned we had a brief conversation or heard about updates this morning, and then went into the LA County Office of Education. So as Gil mentioned, we will have a containment plan, response and control plan in place to review some of those details, including rules, restrictions, etc. We've noted some there for you. The school facilities for non-school purposes will not be permitted. So once students are back, it'll be for educational purposes and school purposes alone. Symptoms checks will be conducted before employees enter the workplace. and we're working through Raptor and some documents to make sure that we're clear on that. But we do ask parents to conduct symptoms checks at home as well before students come to school, in addition to checking temperature. And if the student's not feeling well or has a temperature, we've been asked, and the guidance includes that students do remain home until they're symptom free for at least 24 hours. Number three, anybody or anyone entering the school property, including for transportation purposes, etc., and who has contact with others, are required to wear a face covering, and you'll see that throughout our presentation here today. It's critically important, and it has been probably since April or so. The face covering, the social distancing, staying home if you're ill, washing of hands, etc. We will work with students that may have additional needs or can't, for medical reasons or via the IEP or 504, wear a face covering. It may include an alternative such as a shield that would also need to include a drape that covers the neck and then is tucked into the shirt or the blouse or something they're wearing, in order to maintain as much protection from others and for themselves, of course. Face coverings need to be washed on a daily basis. If that's the one they're going to use, of course, we recommend that students and adults have multiple face coverings at home, cloth face coverings, that they could use a different one and then wash them as needed. But they should be washed daily and not reused. So the same one wouldn't be reused the next day. The classroom furniture, desks, etc., will permit for distance learning, including the desk from the teacher and desks between students be about 6 feet apart. Gil mentioned that a little bit. Physical distancing and face coverings, again, required for anyone entering the campus. The point here is, if they don't have one, we'll provide it, but of course it will be emphasized going forward. Disinfecting, as Gil mentioned, will happen on a daily basis. Cleaning as much as possible in between. And then, of course, frequent opportunity to wash hands. Again, part of the guidance, we believe it's also important. Soap and water will be provided. And then touchless hand sanitizers, Gil showed a picture in his slide, will also be provided in various locations, including classrooms, offices, etc. Next slide, please. So some examples, Gil mentioned the requirement for a certificate to be able to use certain disinfectants. You see here, HSA training is required for specific disinfectants, and they have a long list. But of course, no training is required to use hand sanitizers, and we've been informed as long as they have at least 60% alcohol, they're effective. Soap, general everyday cleaners, those kinds of things. So there's some detail there for you on that. Next slide, please. And then measures that are going to be put in place to ensure physical distancing by staff, students. And again, we're going to minimize visitors. That's going to be very minimal to the basic essential visitor or volunteer. But the maximum number of employees permitted on the campus will be determined by the site administration, depending on size of the room, size of the office, again, to maintain that, that physical distancing that's required for safety. Maximum number of students, same as we see in number one. It'll be determined by the site administration, again, to maintain physical distancing. Gil mentioned 16 students in a classroom. Depending on the size of the classroom, that might be about 960 square feet, but that would allow for a minimum of 6 feet between desks and 6 feet between students and the teacher. We're going to implement measures to ensure physical distancing, of course, include transportation, school arrival through the building and within classrooms, looking at the physical education classes and locker rooms, during school meals on the campus, during breaks, and then, of course, also during or within student support services, the health office, counseling office, and in the administration areas. Next slide, please. Measures to ensure infection control. A lot of the same things that you've heard earlier in Gil's presentation and in my previous slides. Of course, screening conducted, and we ask the parents do that at home with students and keep them home if they're ill. It will get, and we heard from Dr. Ferreira this morning, it may get confusing during flu season. If your child has a cold or is experiencing flu-like symptoms, the recommendation is to keep the student home and to inform the school, of course, until symptoms are gone for at least 24 hours without medication. Screening of adults and of middle and high school age students include questions about close contact with anybody at home that may be experiencing symptoms or tested positive for COVID-19. We're going to, and I mentioned earlier, restrict entry to the campus to those very essential visitors in order to enforce safety measures. Measures are in place to ensure appropriate cleaning and disinfecting of space, as Gil mentioned earlier, and cleaning, of course, on a more regular basis, but disinfecting at least once a day. You've heard me say we're going to enforce face coverings. That's a requirement. Ensure frequent hand washing, staff, students, and visitors, and ensure infection control in the school cafeteria as well, which will include the same measures that Gil mentioned in his regarding the frequent cleaning and the disinfecting at least once a day. John, I think you take it from here. Next slide.
All right. Thank you, Dr. Liberati. And I'm here to talk a little bit about the measures that communicate to the campus community and the public. Doing virtual workshops like this obviously is part of it, but copies of protocol will be posted at all public entrances. Signage will be posted throughout the school, reminding staff and students about the policies. We have a plan in case of full or partial closure. If somebody tests positive, we will share a lot of this information on our website, social media outlets, and then also do some parent workshops as we move into the school year on how to contact the school in case of infection or exposure. All right, Gil, next slide, please. The Los Angeles Department of Public Health has defined some specific measures to ensure the safety and health of students who have IEPs, individualized education plans, and or 504 plans. These are students with special needs. And to go through the IEP process to determine which plan, either remote learning or a hybrid approach, would be best suited for that student. Also an option for grab and go school meals will be offered to any students who is eligible for the school meal program, but would face elevated risk attending school in person. So we are working closely with our special education department and to ensure that there's equitable access to our education plans during this time of COVID. Next slide, please. All right, the big one, exposure management. You get a lot of questions on exposure management and what to do if someone tests positive. And there's some very clear specifics given to us, again, by the Los Angeles Department of Public Health on what to do if somebody does test positive at school. So, for example, if one person tests positive, the home isolation instructions are listed at the www.publichealth.lacounty.gov. You can see for yourself those specific items and regulations and how we would respond if that did occur. What's required is that the school would request that the person who tests positive, the case, would follow home isolation instructions. A case is considered to be infectious from 48 hours before the symptoms first appeared until the time they are no longer required to be isolated. A person with a positive COVID-19 test but no symptoms is considered to be infectious from 48 hours before their test was taken until 10 days after the test. They no longer need to be isolated or will be required to be isolated once they have no fever for at least 24 hours without the use of medication and reduced fevers and respiratory systems have improved and at least 10 days have passed since symptoms first appeared. So again, they're very specific on what requirements need to be met and how long students need to be at home under self-isolation. So what happens is, again, if somebody tests positive, what's required is that we ask the student to follow home isolation instructions, which would be to self-isolate until no fever for at least 24 hours without the use of medicine, and that reduces fever and symptoms have improved and at least 10 days have passed since symptoms first appeared, or if case has no symptoms until 10 days have passed after the positive test was taken. We would let the person know that the Department of Public Health will contact the case to collect additional information and issue the health officer order of self-isolation, which I just read. The school will then work with the person to determine contacts that were exposed to the case at school while infectious. And to be specific, and this is really important, exposure is for someone who is within 6 feet for 15 minutes of the infected person or had unprotected contact with the infected person's bodily fluids and or secretions of the person with confirmed or suspected COVID-19. So being coughed on, sneezed on, sharing utensils or saliva, providing care without use of appropriate protective PPE. So if I'm, for example, a student who sits in front of the class and my best friend sits at the opposite corner of class and I ended up testing positive, unless I am within 6 feet for 15 minutes at a time, my best friend who sits in the back corner may not be identified as somebody who has had contact with me. We also will then notify the contacts, those students or staff who have had contact of school exposure, and request that the contacts follow instructions for self-quarantine and test for COVID-19. They also will be asked to quarantine for 14 days since the date of exposure. The Department of Public Health will follow up to collect additional information, and then the school will also provide the Department of Public Health with names and contact information for case and identified school contacts. If 2 cases are confirmed at school within a 14-day period, we'll follow the same protocol. Gil, next slide, please. Okay. So what if there's 3 cases or more at school within a 14-day period? We're really going to be working hand in hand with the Department of Public Health and follow their orders. You'll see the steps written here that we'll be communicating with the Acute Communicable Disease Control Education Sector team. We'll complete a line list. There's a form on that website that talks about a line list, which is essentially a list of names of everyone who has tested positive at the school. And then they will take that line list and determine whether the outbreak criteria has been met, and we'll contact the school within 1 day to talk about what our next step would be. And again, just simply following their orders with regard to whether we will have to close as a school or whether we be able to stay open. Next slide.
That was it? Or were you expecting another slide, John?
Nope, that's it.
Okay.
Yep.
All right, so at this point, if you have questions, I see a few hands up. I will call on your name and allow you to, mic up. You can close the slides here. And you can ask your question. So I have Catalina Campos. Hi, Catalina, go ahead.
Hi, can you hear me?
Yep, can hear you.
Hi, thank you for all your work that you guys are doing. I applied for the open enrollment during the open enrollment period. And I haven't heard or I haven't received an email with either a declination or an acceptance. And I know that that can happen until August, but I have been already receiving communication from my child's home school. So should I assume that that's going to be the school he's going to in August, or should I still wait on an email from the other school that I asked him to go to?
Can take that. You can go ahead and email the enrollment center and they will give you an update. So if you go to the Family Welcome Enrollment Center link on our webpage, you can email and request status of the open enrollment.
Oh, thank you so much.
Okay. Next, I have Yanette Garcia. Go ahead, Yanette.
My question has already answered. Thank you.
Okay, thank you. I have next Osiris Salgado.
My question has been answered already, sorry.
No problem. And I've got Rachel Rosner.
Hi, good morning. Can you hear me?
Yes.
Thank you so much. Well, I'd like to say thank you to all of you for your hard work. I'm so impressed with everything that you've done and very appreciative. I wanted to ask two questions, if I'm allowed to ask two questions. One is I heard Governor Newsom say at one point that he thought that children K through 3 might be able to wear face shields and coverings. Whether that's something that's being considered or not. And my second question is about whether or not you envision any role for volunteers in the coming year. What can we do as parents who have some time to give for volunteers? Thank you so much.
Rachel, your second question was a little garbled.
Oh, okay, let me try again.
I believe if we can get Osiris to mute, that might help.
Let's see. Yes.
Okay, shall I try again?
Yes. Thanks,
Okay. My second question was whether if you see any role for volunteers in the coming year. What could a parent who wanted to give some of their volunteer time possibly do in the coming year, given the very difficult circumstances? Thank you so much.
Okay, and then I think your first question was regarding shields for kindergarten to third grade students, right?
Yes, that's correct.
Okay, John, do you want to answer on the shields?
Yeah, at this time, we're requiring masks for face coverings for all students, kindergarten through 12th grade.
Okay. And as far as the volunteers, we're really wanting to limit the number of people on campus. It's going to be evaluated as the weeks go on, but really only essential volunteers is what we would bring on the campus. And then that would even have to be defined also. But we really appreciate all the folks who've reached out to myself and Terry Reagans who really want to help. That does not go unnoticed. Our parent support, our community support is so strong in Torrance Unified School District. Being a parent here myself and my wife doing all that work in adventures and arts for all those years when my kids were in elementary. It's not lost on us that we appreciate the volunteer support. But at the moment, right, we really want to limit the ins and outs of folks coming onto our campus. Again, minimizing contact between people. So, but keep your eyes and ears open for when we do reach out, and I could use some help, some volunteer help. Okay. Next, I have Narayana Menuli. Sorry if I didn't get your name right.
Yes, that's right, Narayana Munali.
Okay.
Hi guys, good morning, and thanks for arranging this session, and this is helpful for all the families and the parents. I'm not sure is the right question here. This is more about distance learning. So can I ask any question regarding the distance learning, or is this only for the blended drawing?
Yeah, that was not this session. However,
Okay.
if you...
Yep, I will stop. We'll wait for the next session for the distance learning.
But please feel free to email me, okay, if you
Sure.
have that, and I can get it to the right person. And my email address is mara, M-A-R-A, .gil, G-I-L, @tusd.org. So yeah, you don't have to wait. Just email me, and we can get your question answered.
Okay, thank you very much, and appreciate that.
Sure. I have Valerie Masters next.
Hi, yes, thank you. This is actually her husband jumping in here. Wanted to reiterate that you guys are doing a great job, and thank you so much with all the information you've been providing us. It is greatly appreciated. Just a couple of questions, and I may have missed it. On the cleaning and disinfecting, understand that the cleaning would be between the AM and PM, but did I miss that what happens after the PM? Is that a disinfectant, or is the disinfectant before the AM?
So disinfectant will happen at the end of the day, the disinfecting procedure. So that would happen after the PM, if it's the AM, PM, and of course at the end of the day, if you were during the alternate days, if A, B. So it's an after hours of sorts procedure for disinfecting.
Great. Perfect, thank you. And then just the second question, has there been thought about at some point during the year where a student, maybe in the kindergarten or first grade or second grade, decides to take the mask off or feels uncomfortable with the mask on, about the procedures for that? I might have missed that, but wasn't sure. Wasn't sure if there was maybe like a relaxation or send them to a certain spot in the nurses to take the mask off?
No, at this point, the guidelines are very clear that they must keep the mask on at all times, right? But I know even ourselves as adults, as we have these things on in our meetings, and we pull it down and gasp for air, right? And then put it back up. So we know what the guidelines are, and then we know how some of us tolerate these things a little differently, and we may see the same thing among our students, right? But as far as the black and white in the guidelines, they must maintain, they must keep their masks on at all times.
Right, and I absolutely agree with that. I was just wondering where, at some point, if there was going to be thought on protocol, maybe for a teacher or if somebody, again, it hopefully doesn't happen, but if a student wants or takes the mask off, what is the next step? I don't know if a teacher has to get involved or what. I guess that's just one of the concerns we may have as a student like us,
Sure.
Taking that mask off
Sure.
for a period of time.
Sure. And we can explore that a little further. Maybe that's a deeper discussion with health and safety. Maybe there can be some relaxation of that, and Department of Health would have to, those would almost be questions to Dr. Ferrer. How can we, I guess, make this a little easier on all of us? Can you do that safely? Take it off for a second and take a breath, right? But knowing what we know about the science, 100%, we really should be keeping these on. Knowing, and again, we know that these are not comfortable things to have on our face, but it's important, right? Thanks for your question.
May I also state that a couple of days ago, pediatrician from Cedars-Sinai mentioned that even as early as the age of 2, she's recommending that parents start working with their students to get them used to wearing a mask. And I think the Pediatrics Association is also emphasizing that, but I would encourage that. And as far as involvement by the teacher or other adults, I think that our involvement would be to encourage the student to keep the mask on as much as possible. And if there's something in particular that's happening with the student, we're certainly going to work with all students. You saw the exception in one of my slides that talked about students that may have medical issues. We certainly are going to work with all of our students, but our encouragement is going to be to maintain the mask on, to keep the social distancing. If a student's feeling ill or an adult's feeling ill, to stay home, wash hands, etc. So that has not wavered in any of the guidance that we've received over the last several months. I appreciate your question. We certainly will work with all of our students through the process, but of course, health and safety is our primary concern, and that's what we're going to focus on.
Thanks, Mario.
Thank you.
I think I read somewhere that, we teach our kids to brush their teeth and eat their veggies. We should be able to get them to wear their mask. Although I would probably wear my mask before eating my veggies, but that's just me. So I like my veggies. I have Cynthia next. Cynthia?
Hello, can you hear me?
Yes. Gotcha.
Oh, hi. Hi, thank you. I wanted to find out, I don't know if this was addressed in any other previous meetings, but the shields that you had mentioned where there's going to be about 1,000 of them made, are those going to be designed for separating or dividing the students or covering the students' desk, or is that primarily for the staff?
Yeah, good question. So primarily we want to get them into the places where there's going to be contact with the public. So the front office space, right? Or any spaces where an employee, between employees or between a teacher and a student has to work together within 6 feet. So we do have special cases in our classrooms, SDC classes, some medically fragile students where our paraprofessionals or our LVNs or our health clerks will need to work with, or our speech pathologists, for example, need to work with our students up close. So those are the specialty areas that the barriers will be put into place. It's not needed in our classrooms per se at every desk, because we're separating the desks between students by 6 feet, and as long as the students are separated by 6 feet and they also have their masks on, that not only complies with DPH, but it also, of course, lends itself to what the science says as far as infection, that the chance of infection or transmission aerosolize is really minimal. So that's the purpose of the plexiglass barriers.
And in regards to the tables, because I saw a photo where the table, there's like a tape that was dividing one side to the other side. Mm-hmm. In between the AM, I guess for my elementary kids, AM versus PM students, the purpose of that tape will be designed to do what? Just have the student not touch the other area? And if they do, how would they know that that area was touched? Or is the cleaning going to be done regardless of potential touching or not?
Yeah, the cleaning is going to be done regardless of whether the kid reaches over and touches the other side. So one side of that desk, right, will be the AM group, and then the other cohort that is the PM. So they would sit on the other desk. So and the cleaning would happen between AM and PM, and then of course that evening the disinfecting in the classroom will also occur. So.
Okay, thank you very much.
Sure. Let's see, next I have Narayana. Oh, no, oh, sorry. Paneet Taylor.
Good morning.
Good morning.
So we opted for the 100% distance learning, and on the parent guide, I thought I read that there would be a live instruction 5 days a week, but on the Q&A session a couple weeks ago, I thought I heard that it would be the Wednesday would be asynchronized, just like the blended. I just wanted to get the clarification about that.
I don't think I have anyone here on instruction, although Monday's board meeting, there is going to be some information regarding our distance learning and where we're going. But if you want to email me that question, I can get it to someone and have them answer that question for you.
Okay, sounds good. Thank you.
Okay. Okay, next I have Ozzy Carranza. Go ahead, Ozzy. Can you hear us, Ozzy? No. Okay, I'm going to leave your hand up, so I can call on you later. Tanya Poe.
Hello, can you hear me?
Yes.
Okay, thank you. Thank you guys so much for allowing the students to have, you know, the come to school a few days out the week. My question is concerning, I have my daughter starting high school at North High. And so my question is, and maybe I've missed it, this is my first actual Zoom, but will the students be utilizing the lockers? And if so, how are they going to be cleaned and maintained? That's my first question. I do have a second question. Second question is, with the high school students or the students that are going to go from class to class, how will they be disinfected between passing periods?
Okay, let me take a stab at that. So between passing periods, we can't disinfect, right? And I explained that earlier because disinfecting is a procedure that requires, trained staff, and that they need, we're using a germicide. However, between the classes, we're going to have every opportunity to clean, right? Using alcohol wipes and the appropriate multi-purpose cleaners. So all the teachers will have access to the multi-purpose cleaners, and even the students. So imagine your student walking in their class, grabbing an alcohol wipe and wiping down their desk, right, and then tossing it into the trash so that they can sit there, safely. The lockers themselves, that's in discussion right now. That may, we're working with the principals on. I've heard different. I've heard that the kids will need to use a locker because carrying around the books is laborious, right? Some of these books are fairly large, but the lockers would also go through the same type of cleaning and disinfecting, even if they were put into. So that might be a site-by-site decision. So I couldn't answer for North High at this time.
Okay. All right. Thank you.
Sure. Next, I have, I'm going to try it again. Ozzy, are you there? Yep, okay. I have Michelle Hackett. Go ahead, Michelle.
Hi, can
Hi.
you hear me?
Yes.
Great. This is, I think, an exposure management question / academic question. I'm the parent of a high schooler at West High. If I'm following the bouncing ball here for the hybrid model, the thinking was that the two cohorts, cohort A was meeting Monday and Thursday, and cohort B was meeting Tuesday, Friday. Campus was basically closed to students Wednesday. From an exposure perspective, for anything that lingers after disinfecting, it would seem Monday, Tuesday for cohort A and Thursday, Friday for cohort B would make more sense on its face. So I'm sure there was a good reason why you picked the cohort days as you did. I'm just curious, why did you pick Monday, Thursday, and Tuesday, Friday?
So that, is Katie here? Because that was coming from instruction, from the instruction committee.
I am.
Okay.
Just briefly, that it was absolutely considered, and then decided against when there would be 5 days in between teachers seeing kids. So when they would go on Monday and Tuesday only, and then no teacher contact for Wednesday, Thursday, Friday, Saturday, Sunday, or then go on Thursday and Friday and no teacher contact Saturday, Sunday, Monday, Tuesday, Wednesday. The instructional committee opted to go Monday, Thursday, Tuesday, Friday, fully realizing that there's a difference from a disinfecting management standpoint.
Okay, thanks.
But again, knowing that, we will be disinfecting every night also. So even if even though you have two cohorts between Monday and Tuesday, the campus will still be cleaned and disinfected. Next, I have Pete.
Hi, thank you for having this Q&A. My question is, are protocols being worked on or in place for when athletics come back, since the CIF has put out a calendar for the end of December, January? Thank you.
Okay. CIF. Katie, you know what's going on with CIF?
Yes, I mean, we're closely monitoring. We've got committees, working on what that looks like. We don't have schedules ready to go yet, but we'll be closely monitoring any adjustments that are made once of that CIF schedule. But the athletic directors and the assistant principals in charge of athletics from each of the high schools have been meeting weekly, so that they can keep as updated as possible and alter our schedules as quickly as possible as well.
Thanks, Katie. Paul Myers. Go ahead, Paul.
Hi, thanks. I had a couple of questions that I don't think are related to safety, and so apologies if this is the wrong venue, but just wondering if, I saw that elementary schools could apply for waivers. I was wondering if there's any status on that, or if we're looking into that. And I think in the last call, there was talk about looking at daycare options. I was wondering if there was a status on that as well. Thanks.
Well, the waiver.
I was going to say, I didn't catch your second question, but the first one on the waiver, I mean, that is, oh, sorry. Regarding the question on the waiver, that is something that the state or the county this morning still said that they're waiting on guidance from the state on when that's going to be posted. So that's anybody's guess. But there's quite a process to go through and even apply for it. And that's utilizing, needing one, the application would need to include letters of support from all our labor groups, parents, and community associations that deal with children. And then also the Department of Public Health would look at all kinds of health-related data on the infection, and so based on what we have heard 2 weeks ago from the governor's office about this is still yet to be seen. And so should that be made public in the next week, we'll certainly look at it. But as far as if we can just apply for it and get it relatively quickly, I don't see that that process is going to be there, particularly in Los Angeles County. But again, that's we'll certainly look at it. But health and safety of all of our students would be the primary decision there, students and staff.
Gotcha. Thanks. And the second question was, on the last call, there was talk about potentially using the campuses for daycare, like I think YMCA on site, and I think there was what was said was you were still looking into that. Just wondering if there was a status of that.
Katie, do you have the? I know Edon's not here.
I was seeing if Keith was on.
I think Keith is here.
Yes. I'm sorry, I was getting to my unmute button there. Yes, we are working both with the YMCA and the city to explore what childcare options might be available. We're trying to get pricing right now to see what would be there. And we're also exploring the opportunity, something that our board would have to approve, but can we waive the fees that we would normally charge to YMCA for doing, for having rooms and the custodial services there? Can we waive all that to get the price as low as possible? So I literally have a call right after this with YMCA to try to clear up some pricing. If everything goes well in terms of having the capacity to do this, then we'll send out a survey both to our employees and to parents to find out what need there might be, given how we're returning to school, not physically coming August 26th, and then what happens once we are able to physically come back to school as well. So more to be developed on that, but we're in process.
Great. Thanks, Keith. Next, I have Jillian Wade.
Hi. Yes, I had a question, and excuse me if I missed it on the call earlier. I joined a little bit late, but I was just wondering how you plan to address safety in terms of the bathroom use on school campuses, in terms of whether only one student's allowed in at a time, or how that's going to be monitored, and how we keep their masks on when they're in the toilets and things like that.
Yeah, and bathroom usage has always been monitored, by the teachers, especially at the elementary level. So there'll be protocols in place to ensure that the students are going to be physically distant. The bathrooms themselves will be cleaned and disinfected. So that's down at the site and school level, where appropriate behaviors are instilled in the students, and then of course if there's any discipline that is required by the teacher, that all of those things are enacted. I don't know if John, Mario, if you have anything else to add from a site perspective.
Not necessarily. I think that was fine. I think also from a facilities perspective, students will be able to see that they're maintaining that physical distancing, right? So they'll have some marks on the floor, and they'll be able to maintain that physical distancing when entering different facilities like the bathroom or like the office or like the health office, those kinds of things. Question regarding masks. Again, we're going to encourage students to keep the masks on at all times.
So essentially though, like in between period times and things like that, when they could be going into the bathroom without any kind of, I'm talking like at the high school and middle school level, without any kind of teacher permission or what have you, they just have to monitor themselves and not break the rules of social distancing. Is that essentially what you're saying?
That and the training that will go along with that, yes.
Okay, thank you for answering.
Sure.
We have, let's see, Dan Nguyen. Go ahead, Dan.
Hello, thank you for putting this together and taking these questions. I don't know if this was addressed, I might have missed it, but there's a lot of guidelines around how we plan to keep kids safe and everything. But what happens when someone goes against the guidelines? Like maybe they don't respect the 6 feet or they take off their mask? Like, what is the plan of action when that occurs? Yeah.
Well, as I'm,
Go ahead,
John,
Mark.
let me just start by saying I mentioned earlier, we're going to encourage both from the signage that is up, per the protocols and guidance direction that we have from the Department of Public Health, that that guidance is followed very carefully. You mentioned masks, you mentioned physical distancing, washing the hands, staying home if one feels ill or is experiencing symptoms, and we're going to pursue that by encouraging the following of the protocols, and then should there be an issue where somebody is defiant, for lack of a better word, then we would have to work with that particular individual as we would for in any case when an individual is not following the rules and protocols. And again, as I mentioned earlier, the health and safety of everybody on the campus is tantamount, and we want to make sure to follow those protocols. So we would follow rules. We'd make sure that the folks are abiding by those rules, and then pursue that as we would in any case where somebody's not following those rules. John, I'm sorry if I jumped in.
No, that's perfect. But then also just really promoting the idea of positive reinforcement for following the rules, positive reinforcement for wearing the face coverings, for keeping our social distancing rules in place and following those rules. So I think, you know, there's the consequence side of it where for those who aren't following the rules and addressing that appropriately. But then there's also a bigger culture piece where I think schools are really going to work hard to positively reinforce this idea of here are the rules, here are our guidelines, here's what we're doing to ensure that all of us are safe, and we're going to positively reward folks and acknowledge folks to reinforce those specific protocols.
Thanks. Next I have Mark Imuna. Go ahead, Mark.
Okay, can you hear me?
Yes.
Okay. Gil, on your first slide, at the bottom, it said something like no spectator events or team sports, but it said mention that they can do conditioning and team skills or something. Is that I'm not understand?
Yeah.
You know, like during, if they're going hybrid or distance, is that what are we doing for that?
Well, I know Katie's going to mic up because she's an athlete, so she knows exactly what, because I'm not an athlete, so I'm going to turn it over to Katie.
Yeah, so we have to await, and unfortunately, we just got told today that kids at this time today can only condition at home. They can't even condition it, which is different from yesterday. Can't even condition in socially distanced, environments. So we have to await that guidelines of from the Department of Public Health but we anticipate that we would be able to first go back to where we were a month ago or yesterday, which was starting with the conditioning only. So those are things that like they can't, you can't throw a baseball back and forth because they would be touching that ball back and forth. And the American Association of Sports Medicine has a really good guidance that I think that most, and CIF included, are utilizing, that has kind of like what they're calling stage 1 and stage 2 protocols based on the safety level of when kids are able to do more and more before. Obviously contact sports are the last thing. And I think we can even see that in our professional sports that are trying to reopen, and the difference even between baseball and what football is going through. And so we'll, we will publicize as we get that information. But at this time, we have no permission to do any sport activity or conditioning activity in person for our athletes.
So in high school for PE, what are the kids supposed to do?
So right now we're closed, so that PE will be virtually. So they will have to I mean, I know I've got people in my family who coach, who are, you know, on their Zoom call monitoring what the kids are doing, you know, athletically. So PE versus athletics, I think it's very similar. That coach or that PE teacher will be it's very important for their health, even athletes aside. All physical fitness is very important for them, and they will be doing PE in a PE class, TK, you know, 12. And so they will just have to do that virtually until we can return to school. When we are physically able to return to school and you've chosen blended learning, then we've got processes that our PE teachers are working on where they will be able to do, again, kind of going back to those phase 1 and phase 2 protocols, but how can we safely do physical education while we are physically distanced, and until we are allowed to, you know, maybe have a volleyball game and touch the ball. So the PE teachers, in fact, there's a group of PE teachers working collaboratively right now on how to make sure we can do that, engage kids and not just you know, have them run around the block. And so they're working on that. So different while we're closed than when we can reopen, because because we can't wait to see some of your kids.
Okay, thank you for clarifying.
Thanks, Katie. Rosie Javaid. Rosie, go ahead.
Hi, can you hear me?
Yes.
Okay, I have 3 questions. My first question is, can you address how the district will address the socio-emotional health of a student who's decided to go online and how they can still remain connected to their home school? My second question is how do school classroom pictures look like this year, whether it's online or the hybrid? And then my third question is, are teachers being given the opportunity to teach online or with restrictions to, or with restrictions, I guess. And that's it. Thank you.
Katie, do you want to do a socio-emotional?
So Dr. Egan is not here. That was the you know, his group. I think a lot of these questions that question, because each school will be doing very soon their own info and Q&A, so that because it's very individualized beyond the you know, the information that went out yesterday district-wide, that we're going to be doing some Wellness Wednesdays at a district level, but sites have all been working on this and have their own plans on how they're engaging kids that are distance learning, and I think that's best addressed at the school site.
Yeah. And school class pictures, honestly, I think that's a bit of an unknown right now, since we can't have students on campus and we don't have our photographers that can set up. So I don't think we have an answer for that yet. And then you asked about teachers teaching online. Not quite sure if you can elaborate on, so some of the teachers are, you know, may be teaching at home because they may be at risk and may not be able to come back to our campuses. So I'm not sure if that answers your question. But again, feel free to email me and I can get some clarifying answers. Okay, I have Mary B. Go ahead, Mary.
Hello, can you hear me?
Hello. Yes.
Okay. I have a question. If in one of the past Q&As, it was mentioned that once everything, kids can physically go back to school, if we sign up for distance learning, that our child has to remain on that learning platform for the rest of the school year, and that there is no guarantee that we will be accommodated to go back to in-person learning. My question is, if it's already deemed safe, and I'm talking about hopefully 100%, the virus would be 100% controlled and there were no restrictions, why can't my child physically go back to school? I understand, you have to add more chairs and all that because social distancing will be no longer needed. But is that already a final decision that we can't go back, hopefully, within that school year?
Well, if you've chosen distance learning, right, so right now in my department in IT, we're scrambling to figure out how to get our master schedules done, right? So we've received all of the data, who chose which program. So the difficulty in flipping back and forth is whether or not we actually have space or a section, or if we can even design a master schedule for your student. If you decided to say, I don't want distance learning anymore, I want to come back, there may not be a place to come back to. So it really is dependent on the resources available, number of teachers, number of sections, and space available. So and Katie has said this before, we will try our best to accommodate folks, but it's even difficult, even with what we know now, it's difficult to build this master schedule for folks that have chosen one or the other. So I'm going to leave it at, we will try, but again, there's just no guarantee.
Gil, can I just, I think that she's asking something different. I think she might, and correct me if I'm wrong, Dillian, I think she's asking if the state has told us we can go back 100%, no distance, no social distancing, nothing, going back just like we were before COVID even hit. What would they still be required to stay distant?
Okay, so what we have said is in that event, I mean, we just don't know. That it seems that if we were to somehow get told that there's zero likelihood, and everybody can return safely without any reservations, that it would be worth the disruption to get all of our kids back in school, that we would move to that. But if we don't know what that looks like. We can't even get off the naughty list for one day to even look to consider reopening. So it's but we have said that if that would happen, we would look at that. What cannot happen is that we are going to redo our master schedule in the middle of the year because we have groups of families that want to switch. We have teachers that are going to be assigned distance learning, and kids will be assigned to those teachers. And so we can't just you can't put kids back in school without teachers to teach them. And so, we as I said, like, if this just makes sense, when it goes back to the blended learning option and someone said, well, you just need double the classroom space and you could bring everybody back 5 days a week and still physically distance, that would take twice as many teachers. So you can still only have, we would still need more teachers to do that if we have some families that still want distance learning. So we would really have to get county or state, county, and board direction that we would undo all of the different models and go back to full-time. And we just don't have data or information on if or when that would happen during the 2021 school year.
Okay. Thank you. I wanted to remind everyone that this session is surrounding health and safety as much as possible. So if we can keep those questions on the health and safety. But if there are other questions outside of health and safety, you can of course email myself or Dr. Crumpy so that it doesn't turn into a lot of the questions for Dr. Crumpy on the instructional side. So, but she'd be more than happy to answer those offline. Okay, Puspita. Go ahead, Puspita.
Hello.
Hello. Yes.
Yeah, good morning, everybody.
Good morning. Go
Yeah,
ahead.
so my son will be a 8th grader, and he's supposed to take classes in high school. So before we were told that he will go there by bus. So I don't know what is going to happen now. I chose the hybrid model, so he will probably go to school 2 days when he can go back to school physically. So how will you maintain, like in the bus, it's scary to go now. So what's going to happen now?
So the protocols for physical distancing apply to our transportation also. So our bus drivers will have all the protocol in place. We're marking off every other seat on our buses so that they're staying apart, and the students will be required to keep their masks on as they're being transported, between from home to school. So that doesn't relax whether or not you're coming into a physical classroom or whether you're getting onto a bus. Physical distancing and making sure you have your mask on, all of those protocols will be enforced. So, and again, as if we can again open up again, that will be enforced on our buses. Does that answer your question?
Okay, thank you so much.
Sure. I have Bethlem A. Or Beth?
Yeah, Bethlehem. Sorry.
Okay, Bethlehem. Okay.
I'm sorry. It's not a health and safety. It was just a quick question for those of us who chose distance learning. Would the teachers be coming? Would we still have the teachers that we're assigned? Like my kids go to Jefferson and Anza. Would it be from Anza and Jefferson, or is it just a pool of teachers? And I don't know if I missed that answered, if it was answered before.
Yeah, it would depend, right? And we're working through that right now with our master schedules to see if we can match up appropriately the number of students that are on distance learning and the number of teachers we have in distance learning. So they may or may not have teachers from your home school. And then, Katie, I know you wanted to avoid this, but if you have anything else to.
No, it all depends and on, if you chose distance learning, there's no guarantees that those teachers are going to be from your home school. You will still be at your home school. We still link you with your home school. Your principal is still your principal at your home school. But if you're an ANZA student, it may very well be a teacher from Lincoln Elementary School. It all depends on the teacher needs and the number of students at the grade levels and trying to put them together. And we have to share across to make complete classes. We have to share across schools.
Thanks. Okay, I've got Carissa Unukai. Sorry.
Hi, can you hear me?
Yes.
Hi, thank you so much for this presentation and for all that you guys do. Thank you also for clarifying what would happen if there's one case in the school, 3 or 4, etc., and explaining that it has, the person who has been infected has to be in contact with another person 6 feet or more than 15 minutes. If it's the teacher that tests positive, does that mean that automatically it's assumed that the whole class, or if the teacher is teaching 2 classes, that it's automatically 30 students, therefore it's the whole school?
I think we would follow the same protocol, whether it's a student or whether it's a teacher that tests positive. We would follow the specific protocol. 6 feet is what they've defined for 15 minutes or more. All of those students who have been identified as having contact 6 feet or closer, 15 minutes or more, then would be identified and asked to self-quarantine. And then, of course, we'd follow our direction from the LADPH, Department of Public Health, moving forward on whether or not more cases turn up or less, and follow their order.
Thanks, John.
Okay, and one last thing. I know in one of the first few slides, you had mentioned that you are improving ventilation. Can you explain a little bit how that's being done?
Yeah, so in our classrooms, of all of our classrooms, that we 1,200 plus classrooms, 18% of our classrooms have air conditioning, so AC. So the recommendation is, of course, to provide as much fresh air into the classrooms. So we're allowing for our ACs to, allow the teachers to adjust the thermostats down so they can be cooler. It does allow for fresh air to come into the classrooms. And then we do the changing of the filters 3 times a year. So we're going through them next month, and all of those will be changed out in the next few weeks. In our classrooms that don't have air conditioning, the recommendation is to open the doors and windows, and we'll be stockpiling fans, literally fans, for our teachers, so that they have a supply of equipment in their classrooms that allow them to move the air around in the classrooms. So it's that's the recommendations that we're following from DPH, is to try and get as much air movement in our classrooms as possible. Granted, we know that we're probably coming up into some warm weeks, right? Even though we're staying at home in the beginning, but who knows, if we do get off the naughty list and maybe we come back to school in October or November, that things can get warm in the classroom. And so it can be uncomfortable. We've heard this comment before, well, it's uncomfortable, it's warm, and I have to keep a mask on. But that, we'll do the best to keep the air moving in our classrooms. So. Okay, next we have Flo Fujimoto.
Hello.
Yes, hi Flo.
Can you guys hear me?
Yes.
Oh, okay. Just making sure. Regarding school year, and because he wears glasses, we've tried the face shield, the face mask, but as you know, if you wear glasses, it kind of fogs up. So being that he's very young, we've switched to having him wear the face shield, which goes over his glasses, and it has been much more successful with, having him keep that on. Is that an option that he will have as he enters schools?
John, you want to answer the, Unfortunately, no. The Department of Public Health has been pretty clear. Face shield is not a replacement for a face covering. So unfortunately, we would just have to work hard and support your child as best we could. With regard to glasses, I can feel, I understand completely
Yes.
what he's going through, and it's something that we would just have to do our best to help support him.
Okay.
But unfortunately, again, the orders have been pretty clear. Face shields are not a substitute for a face covering.
Okay. All right. Sounds good. Thank you.
Thank you. We're coming up close to our hard stop at 11:30. Got about another minute, so we'll take one more question. Gina Sand.
Hello.
Hello.
Can you hear me?
Yes.
I just wanted some clarifications. It sounded like when a person tests positive and they have to quarantine, it sounded like it had to be done in one business day, and then something was to be done in another business day. So does that mean that 2 days pass before we find out that a person is tested positive in the class?
let me try that one. So if an individual, whether an employee or a student, has significant symptoms or has tested positive, that individual will isolate as soon as possible. So as soon as we know, that individual will isolate. If they're on the campus with significant symptoms that point towards COVID-19, parents will be called, or guardians will be called immediately to pick up the students so they can start isolating. We contact Department of Public Health, and we start the contact tracing immediately, as soon as possible. And we work through that process, as Mr. Pearson indicated, informing folks that have come into contact with the student and or the adult, so we could then, depending on the contact, quarantine those individuals. And of course, our recommendation for individuals that are in quarantine is to schedule and be tested for COVID-19.
Thank you, Mario. Okay, we've hit our 11:30 mark. I really appreciate everyone that's come online today. Seems we have a few hands still up. Please feel free to email me directly if your question was not answered or if you need clarification on some of our answers. I don't know if Dr. Stowe had any parting words for us.
Just thank you for everyone that came, and hopefully it's interesting. We had a mix of questions, so it wasn't all about the health and safety, which is good. You know, we have tried to make sure that we're communicating as much as we can with folks about specifics. We do have another special board meeting on Monday night at 7 p.m. so you can zoom into that and watch if you are so interested. But again, please keep the questions coming, and you know, your principals are back in a week or so. But I know, you know, we meet with them on Wednesdays all summer. We have been, and I know they're responding to questions as well that are maybe site specific. So you know, please continue to email. That's seems to be the easiest form of communication through this whole process. So thanks again, and we appreciate you being here.
Thank you. Have a good day, everyone.
Thank you.